Welcome back, everyone, to another deep dive. This time, we're taking a closer look at a role that's absolutely critical in the world of healthcare, the medical administrative assistant. It's a job that I think often flies under the radar.
Oh, absolutely.
People might not realize just how much these folks keep things running smoothly in doctors' offices, clinics, hospitals, the whole shebang.
Right. It really is the backbone of the healthcare system. I mean, think about it. Patients, treatments, paperwork, everything flows through them.
Exactly. And that's what we're going to unpack today. So let's break it down. What does a medical administrative assistant actually do? Like beyond the typical image of answering phones and scheduling appointments.
Well, that's certainly part of it, but it goes so much deeper. I mean, they're handling sensitive patient information. They are the guardians of medical records.
So they're dealing with high pay regulations and all that.
Oh, absolutely. High pay compliance is a huge part of their job. They got to make sure every piece of patient data is kept confidential and secure.
Makes sense. So we're talking about updating medical records, processing insurance claims, handling billing.
Yep, all of that. And they need to be meticulous and organized. Any mistake could have serious consequences.
It's a lot of responsibility. So, thinking about other roles in healthcare, I have to admit I sometimes get medical administrative assistants mixed up with medical assistants.
Oh, yeah, that's a common one. It's easy to get those two confused.
So what's the key difference? Where do they diverge?
So, medical assistants are more hands on with patients, taking vital signs, helping with procedures, maybe even giving medications under a doctor's supervision.
So they're closer to the clinical side, while medical administrative assistants are more focused on the administrative tasks.
Exactly. But here's the interesting thing. Even though their duties are different, their salaries are pretty comparable.
Really? That is surprising.
Yeah, on average, both roles earn around $38,500 a year.
Huh. Interesting, but I guess there's probably a lot of variation depending on experience, location, maybe even specialization.
Oh, for sure. And that brings us to another key point. Career paths for medical administrative assistants are super diverse.
Okay, now that's what I want to hear more about. What kind of paths are we talking about?
Well, one direction is moving up the administrative ladder. So you could start as a medical administrative assistant and work your way up to office manager or even a practice administrator.
So leadership roles where they're overseeing the entire operation.
Exactly. They use their knowledge and experience to manage the staff, optimize workflows, really make sure the office runs smoothly.
Okay, that makes sense. But you mentioned another path.
Right. Some medical administrative assistants actually use their experience as a stepping stone to clinical roles.
Wait, really? So they could potentially transition becoming a medical assistant or even a nurse down the line?
Yep. It's actually a pretty smart move. They already have a solid understanding of the healthcare system and patient care from their administrative work.
That's so cool. It shows how valuable those administrative skills are. They can open doors to all kinds of possibilities.
For sure.
So let's get practical here. If someone's listening and thinking, hey, this sounds like a good fit for me, how do they actually become a medical administrative assistant? What's the first step?
Well, some people do land these jobs with just a high school diploma and some on-the-job training.
Oh,
But having some formal education or certification can give you a real leg up.
right, like a certificate program or a specialized course that focuses on medical administration.
Exactly. Those programs teach you the essential knowledge and skills you need. Everything from medical terminology and billing practices to, of course, I-pay compliance.
Makes sense. It shows potential employers you're serious and that you've got the foundation to do the job well. But what about those soft skills, those interpersonal qualities that are so important these days? Are those relevant here too?
Oh, they are absolutely crucial.
Because at the end of the day, this is a people-oriented field.
You got it. They're the first point of contact for patients. So they need strong communication skills, a knack for problem solving, and, a healthy dose of empathy.
They're kind of like the face of the practice.
Exactly. And it's not just about patients. They got to communicate effectively with doctors, nurses, insurance companies, everyone.
Sounds like it takes a lot of diplomacy and tact.
Definitely.
So to sum it up, we've got these essential hard skills like medical billing and coding, IPA compliance, all that good stuff.
Mm-hmm.
But then we've also got those crucial soft skills, communication, empathy, problem solving. It's a pretty powerful combination.
Absolutely. And we can't forget about technology.
Oh, right, technology.
Yeah.
Medical offices are becoming increasingly reliant on, electronic health records, all sorts of software programs.
Exactly. That's a whole other layer to consider. And it's only going to become more important in the future.
Which is actually a perfect segue to our next segment. We'll be back after a short break to dive deeper into the evolving world of medical administration and how technology is shaping the future of this career. Stay tuned.
So yeah, we were talking about technology. It's definitely shaking things up in healthcare.
Big time.
Yeah.
And I'm thinking specifically about telehealth. It's not just a buzzword anymore, is it? It's really changing the way care is delivered.
Oh, absolutely. Telehealth is a total game changer, and it's having a huge impact on medical administrative assistants.
So instead of just managing a physical waiting room, they might be managing a virtual one.
Exactly. They might be troubleshooting tech issues for patients who are having virtual appointments or coordinating follow-up care online.
Wow. It's almost like they're becoming tech support specialists on top of everything else.
In a way, yeah. Their tech skills need to be top-notch these days.
So it's not just about, basic computer literacy anymore.
Nope. They need to be comfortable with telehealth platforms, electronic health records, and all the security protocols that come with handling patient data online.
It's a whole new level of responsibility.
Definitely. And then there's AI.
Artificial intelligence. Now that's a whole other can of worms.
Yeah.
How is AI impacting medical administration?
Well, think about it. AI can automate a lot of the routine tasks that medical administrative assistants handle.
Like what? Give me some examples.
Appointment scheduling, for instance, or billing, even pre-authorizing insurance claims.
So we're talking about AI systems that can basically do some of their work for them.
In a way, yeah. Which brings up some interesting questions, right?
Like what?
Like, how do we prepare medical administrative assistants to work effectively alongside AI? What new skills will they need to develop?
It seems like the training programs would need to adapt pretty quickly to keep up with all this.
Oh, absolutely. We can't just teach software programs anymore. We need to focus on critical thinking, problem solving, and even ethics when it comes to using AI in healthcare.
Because at the end of the day, healthcare is still about people.
Right. Absolutely. Technology can assist, but it can't replace that human touch, that empathy, that connection.
So the ideal medical administrative assistant of the future will be someone who's tech savvy, but also has those strong interpersonal skills.
That's the winning combo right there. And I think we're also going to see more specialization within this field.
Oh, specialization. Tell me more.
Well, as telehealth keeps growing, we'll need people who are specifically trained in telehealth coordination. They'll be the experts in managing virtual workflows, troubleshooting technical issues, making sure everything runs smoothly online.
So kind of like niche experts within the broader field of medical administration.
Exactly. And we might see data analysts who specialize in electronic health records, pulling out insights and helping to improve patient care.
That's pretty cool. It's like a whole new branch of healthcare administration is opening up.
Yeah. And it's not just about new job titles. Existing roles will evolve too, The medical biller of the future might need to know how to code for telehealth services. The receptionist might be interacting with patients primarily through online portals.
So it's about lifelong learning, staying flexible, being willing to adapt to new technology and new ways of doing things.
Absolutely. But with all this change, there are some potential downsides too, right?
Like what?
Well, job displacement is a big concern. I mean, if AI and automation can handle more tasks, what happens to the people who used to do those jobs?
Right. It's the classic fear of robots taking over, but in a healthcare setting.
Yeah. And it's a valid concern. But I don't think these jobs are going to disappear entirely.
Why not?
Because the human element will always be essential in healthcare. We need people who can show empathy, think critically, solve complex problems. Machines can't do that, at least not yet.
So it's about finding that balance, right?
Right.
Figuring out how to leverage technology to enhance our skills, not replace them.
Exactly. The medical administrative assistants who thrive in the future will be the ones who embrace technology and use it to their advantage.
This has been really eye-opening. We've covered so much ground today.
We have. From the core duties of a medical administrative assistant to all the exciting possibilities on the horizon.
We talked about the importance of both hard skills and soft skills and how technology is reshaping this entire profession.
Yeah, it really has been a great conversation.
Before we wrap things up, I have one last question for you. If you could give one piece of advice to someone who's considering a career as a medical administrative assistant, what would it be?
One piece of advice. I would say go for it. But, go in with your eyes wide open.
Okay. Meaning?
Do your research. Talk to people who are already in the field. Really understand what the job entails, both the good and the, well, maybe not so good.
The challenges, the demands.
Right, because it's a rewarding career, but it's not for everyone.
Definitely. And with technology changing so rapidly, it seems like adaptability and a willingness to learn new things are key.
Oh, absolutely. Lifelong learning is essential in this field.
Speaking of learning, this deep dive has really got me thinking about the training process. What if you could design like the ideal training program for a medical administrative assistant? What would that look like?
Oh, that's a fun one. Well, first of all, it wouldn't be just sitting in a classroom listening to lectures.
Right. More hands-on?
Exactly. Lots of simulations, real-world scenarios, like dealing with a difficult patient.
Okay, yeah. Or maybe navigating a tricky insurance claim.
Exactly. Or what about a technical glitch during a telehealth appointment? Got to be ready for anything.
It's like a flight simulator, but for medical administration.
Huh. I like that analogy. And of course, it wouldn't just be about technical skills. We'd have to build in those soft skills, too.
The communication, the empathy, all that.
Yep. And problem solving, stress management, the whole package.
Wow. That sounds like a pretty comprehensive program.
It would be. And I wouldn't just hand them a certificate and say, good luck out there.
Right. More support.
Oh, yeah. Ongoing mentorship, networking opportunities, continuing education resources. They'd have a whole community to back them up.
That's amazing. It sounds like you're really passionate about this.
I am. These are the people who keep our healthcare system running. They deserve the best training and support we can give them.
Well said. And on that note, I think we've reached the end of our deep dive into the world of medical administrative assistants.
It's been a fascinating journey.
It really has. And I hope our listeners are feeling just as informed and inspired as I am.
Me too.
So to everyone out there who's thinking about a career in healthcare, don't underestimate the power of medical administration. It's a challenging but rewarding field with so much potential. Keep learning, stay curious, and never stop exploring the possibilities.
That's what it's all about. Thanks for joining us.
And until next time, keep diving deep.